I would like to introduce Dr. Beani from Calambrone. The title of the presentation is Feasibility of Home-Based Action Observation Training for Children with Unilateral Cerebral Palsy. Okay, good morning, everyone. We know that unilateral cerebral palsy is the most frequent form of cerebral palsy and is a pathology which involves one side of the body and mainly the upper limb than the lower limb. And that's the reason why the rehabilitation programs are mainly addressed to improve the manual abilities and upper limb use in daily life activities. So we know that there are many rehabilitative approaches, and one of the newest one is the action observation therapy. That is particular rehabilitation approaches in which we stimulate the mirror neuron system. That is the system of neurons which are activated not only when we perform an action, but also when we see someone performing the same action. So we know that in many groups, researchers and clinics are inserted these new approaches in their rehabilitation practice. We are here because we know that information and communication technologies gave their support to the research and to rehabilitation in order to increase treatment opportunities for all patients. And the aim of the work I'm going to present to you is to investigate the feasibility of a new rehabilitative home-based approach that is called the Teleneuroriabilitazione in a group of unilateral cerebral palsy patients. In that project, we are delivering a platform for home rehabilitation, and we gave a program of 15 training sessions to be performed directly at home with families, to be performed 5 days a week, so it's a 3-week program. And every day, children and adolescents performed 3 actions with increasing difficulty every day, and with the platform I'm going to present. And we remotely follow their treatment. This is the Teleneuroriabilitazione system. So this is composed by a clinical library of all exercises, which are exercises both unimanual and bimanual with bimanual actions. Of course, as I said before, there are 3 different actions for every day. So every day the action changes, and there is an increasing difficulty both in the same day and during the day of training. Then we developed, thanks to the engineers of Scuola Superiore Sant'Anna of Pontedera in Pisa, 2 different softwares for the presentation of the video that children look at. So we had an interface for children and another for adolescents. Then we delivered this computer you see here, and it's composed by an observation module, the one for the observation of these goal-directed action videos, and the motor performance module that is composed by a box with toys that are similar to the toys and objects that the children and adolescents use in their daily life. And these actigraphs that are inertial sensors to be worn as bracelets thanks to the Velcro straps, in order to record also the activity of upper limbs. We know, and we are here because we are stressing the fact that it's very important not only to validate the platform to be used, but also to assess the feasibility, the acceptability, and the usability. And I'm very happy that many works stressed this concept. There is also a very interesting posters upstairs in which we are presenting our review that we have just submitted, in which we investigated which are the right methods to assess the home-based technologies. So the main conclusion of this work is that we can use whatever we would like. So if we would like to have a questionnaire or an interview, we can do that.
but it's absolutely important to refer to standard items, and this is what we did. Okay, so we validate the platform by means of the RCT that Dottoressa Sgandura is going to present. We assess the feasibility with the 9 criteria that also Dottoressa Bardoni mentioned it just now. So we use the items for the feasibility both of intervention and for study design and procedure. And then concerning the usability and acceptability, we developed a purpose-designed questionnaire in 2 forms, so in a printed version or in a Google module version, in which we create some ad hoc questions. And within these 4 areas you see here, so customization of the exercise we plan for them, the acceptability of the teleapp platform at home, the required effort, there is an error here, for the participants, and the suitability of manual and software. And the answers were organized in a Likert scale, and we have also S-bilometers for very young children in order to let them make easy to answer to questions. And then we also recorded, because all participants during the training, they take notes on a diary, so we exactly know for how much time they were actigraphed, and we had also some question about that. So we assess also the wearing rate of these bracelets in order to understand their acceptability. I'm going to present the results of 29 unilateral cerebral palsy children. We had 8 with right side affected and 21 with left side affected side. There were 15 males and 14 females, and the mean age is about 12 years old. Okay, so starting from the 9 criteria we saw before, we are very happy to present these results. Mainly for the feasibility of study design and procedure, because we are happy to announce you that we did not have any data loss. So it was possible to collect all outcome measures in all time in this study. And concerning the feasibility of intervention, these data, I think they are very beautiful, because we know that the accessibility and the technical smoothments were very, very high. Just few words for the training compliance and the training motivation, mainly due to the fact that some participants performed the training sometimes during a very busy period of their life. I mean, school, sports, and therapy. So someone just said, okay, it was very good, it was useful, but a bit hard to organize in my week. So I think that is a bias related to that thing. From the other side, there were just one participant that had to perform this training during holidays, so you know that he was not so happy to do it. Okay, concerning the questionnaire, all scores of answer of total score in the questionnaire were all above 82%, so the satisfaction seems very, very high. And analyzing each area, we can see that all scores are very, very high. So you see a little variation in the acceptability at home, mainly because sometimes, home could be organized in different ways. So that could be a reason why we have such variability. And we did not find any difference for age or sex. So the acceptability and usability of that system was quite the same, both in children and adolescents, and both in male and female. And we are very happy because we try to structure the training and the activities, taking also, having in mind also sex preference or age preference. So it was not so easy, because, we have to choose the same, the action could be compared, but a little bit customized based on the patient. But I think that this data could be satisfied and promising for further studies. Okay, if we analyze the actigraphs, because just a precision, they had to wear actigraph both for assessment, as you can see here, during the training, and of course we asked to wear actigraph also during their daily life. And that is a good link for future works, because we would like to analyze not only what happens during a training, but also to daily life. And if you see the active wearing time rates, they start from 26% up to 99%, so high variability, but we have a median value of 86%. So only 8 subjects had values less than 50%, and this was mainly due to the fact that they would like to remove the bracelets during the night. And the only participant who has the 26% was an adolescent who just would like to wear active during the training because, you know, it's a particular age, so he would not to go out of his home with actives. But it's interesting data for us. Then, concerning the validation of the platform, I'm inviting you to follow the relation that is just after me, in which we are going to present the complete RCT study. So here I reported just some comments coming from this questionnaire because, of course, it's a Likert scale questionnaire, but we have also the we asked participants feel free to add some comments, and here you can see some of them. So someone says that the movement of the training action are useful for daily life activities as insert the key in the door. So we are very happy that there is this link because, of course, we did not use a door and a key in the training. This is a very young participant, she said, the second time I performed the action is easy for me. So we know that it could be a bit boring to observe twice videos. So they observe and perform, then they observe another time and re-perform the action. And they understand that it's important to do it twice. Another participant said that also if my disability is not severe, so it's very slight disability, it's curious to notice new action I can perform. So some of them just discover new action they can actually perform. And another thing is that I miss wear active after the training period. So some of them, okay, they said, okay, it's too boring to wear it and remove in the night or for the shower. But then when the period finished, they said, okay, just finished, I would like my actives because maybe they are beautiful for them. Here you can see some drawing of them. So our conclusion is that TeleAppCat system demonstrated to be feasible at the platform to be delivered at home, and the TeleAppCat system is useful, feasible, and accessible to children and adolescents with unilateral cerebral palsy. Thank you for your attention.
Thank you to Dr. Beani also to respect the time you have. And we have time for one question with a short answer. Okay.
Very interesting. I was particularly interested in the age of the children that you selected, because I would have thought that this would be better to introduce at a younger age when there was more plasticity and less muscle decay. Have you thought of introducing it? Is it appropriate for younger children?
Yes, of course, is one of our challenge of the future, because, you know, we selected starting from, school age or just little before school age, in order to have the guarantee of the good attention to the videos and to be able to follow the training, because data we collected show not significant from a statistical point of view, but a little difficult in younger children, 5.5 to 6 or to 7 in performing that training. So we are going to adapt this approach also in very young children. So this is one of our future perspective, of course, and thank you for your question.